Hey everyone, it's Crystal here at the AAFE, and today I am treating one of my patients with a little bit of lip filler, and then towards the end of the video you will see that we will do a little bit of neurotoxin treatment as well. So this patient actually had her lips done about 3 or 4 months ago for the first time, and we did a really subtle lip enhancement. She was kind of nervous to get lip filler for the first time, so we started with a very small amount. Only did about like half a syringe, I would say, in her first session, and she loved them. But of course, like every other patient that gets lip filler for the first time, usually after the first couple of months, they get used to the way their lips are looking and they want a little more. So today we are doing just a little bit more of the same product that she got a few months ago. So you can see I'm strictly using Comfortox 0.5 syringes. I just love doing lips this way now. I feel like in the past year or so, this is really what I've been doing for the majority of my patients because I feel that I just have more control over the syringe and over the filler, and I can be really perfect in where I'm putting the filler and just make it really nice and perfect. So also the needle is a little bit smaller, so it tends to be less pinchy, less painful for the patient as well. And because we only use topical anesthesia, I believe that it also helps the patient throughout the procedure. So I have been using Comfortox syringes backfilled with filler for a while now for lips, and I absolutely love it. And this way I can kind of go from using the right angle technique to using standard volume technique and just kind of go back and forth without worrying about using multiple syringes and different gauge needles and whatnot. So you can see I'm just adding a little bit kind of in like each quadrant of the lips. Just to give her like a little extra oomph. So she loved the shape, she loved the outcome of her lips. She just wanted a little bit more volume, so that's exactly what we did. So just touching it up a little bit. I think I added like 0.5, 0.6 maybe of a syringe, so not too much at all. And just kind of placing it everywhere. You can see like once I've kind of put filler in all areas, then I'm just kind of doing little fine tunes. So pulling down that bottom left corner of the lip a little bit more to match the other side and making sure everything looks nice and symmetrical. Doing the same thing on the top as well. Moving on, you can see that just doing last little minute touch-ups in areas to make them as perfect as possible. I tend to be kind of a perfectionist when it comes to filler and take my time and be nitpicky with it. So you'll see that I kind of take time, really look at the patient, have them sit up, have them smile, look and see how it looks when, they talk and they animate, and correct little areas accordingly. So then once I kind of do all of that, I always give the patient a really good massage. And then after the massage, I will also look again and make sure, does it look good? Does everything look even? Does she need more in any, one area? And for this particular patient, I think it looked really good. So I also always have the patient look as well, because I would hate for the patient to not see, and then once they look in the mirror, they see a little spot that's bothering them or whatever, and then that's all they're going to look at for the next couple of weeks, and it's going to bother them. So I would rather them look now and see if they can pinpoint anything that's bothering them, any little asymmetry or something like that, so that it can be corrected before they leave. So she loved them, and those are done. So you can tell she did have a little bit of swelling on board. Obviously, that kind of goes away within the next 3 to 4 days. So now moving on to her neurotoxin treatment. Typically, if I'm doing Botox and filler in the same appointment. I always do filler first, regardless of where it is. And then I finished with their neurotoxin treatment, just so I don't have to worry about touching the neurotoxin, moving it around, or anything like that. So I marked up her frontalis, her glabella, crow's feet, and a little bit of a brow lift. So as you can see, making sure I'm evenly treating the entire frontalis, so from lateral border to lateral border, to ensure that it's treated nice and evenly, keeping my dots spread apart so that the product diffuses nicely and treats that entire muscle. This patient has been with me now for a few years, so she kind of knows the drill when it comes to neurotoxin. So definitely you can tell, even when she was animating for me while I was marking her up, her movement really isn't that strong because she has been receiving treatment pretty much every 3 to 4 months for the last 3 years. So keeping up with it will definitely help in softening those wrinkles over time. Your muscle movement and strength is not going to come back as strong as it once was prior to starting neurotoxin, because it's really just going to atrophy that muscle over time. So we've come a long way with her, and she's looking very good. So that was just her glabella treatment. Now kind of moving over to her crow's feet. I always pull the skin nice and tight so I can see if there's any vessels, so that if I see them, I avoid them and then they won't get a bruise. Doing the same thing on the other side, always injecting up and away from the eye. It's just the safest way possible. And then lastly, we're going to end with a little bit of a brow lift. So she does have heavier eyelids, more hooding. So I do it over 2 injections just to really give good overall lift. And I do the same thing on both sides because her brows at baseline are pretty even. So all of these areas besides the brow lift are taught in our level 1 Botox and filler course. And then we teach the brow lift and the more precision technique in level 2. We hope to see you guys there soon. And thank you so much for watching.